Okay. Hi, my name is Allison Wyndham. I am here at the Lamar Speech Clinic. I have a colleague here. His name is Mr. Ian Stokeham, and he is here with his patient, and we are going to be demonstrating a circumlaryngeal massage technique for her as she is presenting with muscle tension dysphonia. So before we get started, circumlaryngeal massage can be used to help warm up the use to warm up the voice before use, and it can be used to restore vocal quality and to reduce vocal symptoms such as strain or tension. Laryngeal massage assists the muscles of the larynx, which is also known as the voice box, to stretch and relax. It promotes circulation in the laryngeal area and it relieves discomfort associated with any excess tension. If you can reduce the muscle tension through direct massage and manipulation, you may be able to reduce some of those symptoms that you're having. Singers who often use their voice will sometimes benefit from circumlaryngeal massage. Also, patients who present with muscle tension dysphonia, anyone experiencing any type of vocal fatigue, hoarseness, pain, soreness in the voice, those are patients who may benefit from a circumlaryngeal massage technique, as you are going to be showed today.
That's right. So Miss Wyndham, I'm gonna take my patient, Miss Parker here,
Okay.
through the steps of circumlaryngeal massage, and you just let me know if I miss anything or if I'm in an inaccurate location. All right, because I know
Okay.
you're the
Sounds good.
expert on this. All right.
Sounds good.
Are you ready, Miss Parker?
Yeah.
Great. So I'm gonna do it on my throat, and you do it on yours. Okay.
Okay.
So we want to start. Well, first, get your body relaxed, sit up straight, get your head in a straight position, and relax your neck. I like to kind of move from side to side a little bit just to get loose, just get a little loose. And then I take my fingers here, and while looking straight ahead, I try to find this notch, this gap right above my Adam's apple. Do you feel it? Okay. Now we're going to just kind of massage that a little bit. If you feel any tension or soreness while we're massaging, that's a good step, and that's something that you want to continue to work on to rub the stress out. Does that make any sense? Okay. So we're loosening up the muscles there. Now the next step, this is what I call the center, by the way. So the next step is when we go around, and we're going to kind of take our finger and thumb and gently move around the larynx in a somewhat horseshoe shape. Does that make sense? So we're starting at the center and just gently massaging that area until we reach the corners of our throat. We're just getting all those muscles there nice and relaxed. And then once we get to the corners, we're at what I call the corner stage, right? So we want to get into those corners, really work out the muscle tension. And then we're going to bring that down along this groove right here between the big muscle in your neck and your larynx. And we're going to stop right about the same space as the Adam's apple there. We don't want to go too far down, only about 2 inches. Does that make sense? Are you with me? Looks like you're in a good place too. Okay. Now, once we did that, we're going to take our hand off, let that relax a little bit. And then we want to find about 2 inches down the horseshoe. Or not 2 inches, I'm sorry, about 3/4 of the way across. There's going to be these two little grooves, right? And we're going to yawn. And then I'll kind of open that up, and your fingers will naturally go in that position. Are you there? Okay, good. Now we're going to gently wiggle from side to side our larynx, just to kind of get it loose. And slowly, gently, while we're wiggling, bring it down. So we're stretching the muscles underneath our jaw. Just ever so slightly bring it down. And now I like to go up and do it a second time. Just real quick, bring it down. And good. Just give those muscles a nice little stretch after a massage. Now that, if I'm correct, is the steps of the circumlaryngeal massage. Is that all right to you, Miss Wyndham?
That was great, Mr. Stokeham. How are you feeling, Miss Parker?
Good.
Do you feel better?
Good,
Yeah.
good.
Awesome.
Good. And I think Ian pointed out in the beginning maybe, but if you're ever sore, then the keyword we say is massage more. So to release some of that tension in your larynx.
I believe Miss Wyndham mentioned that if you massage before the vocal use that you do every day, that can help you get the most adequate care out of this process. Does that make sense?
Yes,
Do you
thank
feel
you.
better, Ms. Parker?
I feel much better.
Great. Great.
Great. We love to hear that.
All right. Thank you very much, Ms. Wyndham.
You're welcome.